Nobody wants their everyday activities to be limited because of pain, but shoulder pain can do just that if it goes untreated. Dr. Rudy Gari from Florida Pain Relief Group joins us now to talk more about shoulder pain. And my gosh, this is my life right here. Shoulder pain constant. What causes this, and is it degenerative?
Well, that's one of the types of shoulder pain is degenerative. Other types of traumatic. Example, my son was, he thinks he's Superman, and he was working out at the gym, and he extended his arms, and he dislocated his shoulder. We actually took him to one of the best surgeons in the country, who said, well, maybe he needs surgery. He had a little bit of a tear there. Instead of having surgery, we actually brought him back to our facility and put in some stem cells into his shoulder. And he's young enough, and actually allows him to regenerate that tear. So
even a tear can be fixed without surgery. That's the first I've heard of that.
We've actually seen MRI evidence before and after. Because stem cells regenerate, we've seen the little mice with an ear on his back. Okay. That's regenerated tissue.
Wow.
That's the future of medicine. And so we're doing a lot of treatments for joint pains through stem cells, allografts, it's called now regenerative medicine.
That's great, because I know somebody who recently had shoulder surgery, and the recovery is worse than what he was going through before the shoulder surgery. It's really a long time.
A big operation.
Yeah.
Some patients need it, but it really is a big operation, and it's a very long months. It can be the recovery period.
Definitely. Now let's talk about arthritis. We think of it as being in our knees and maybe in our hands, but can we get it in our shoulders?
We get arthritis in every joint, not only in our knees and shoulders. We actually see a lot of arthritis in your back. Your back has 31 different bones. Each one of those bones is bonded together through these little joints, and they're called facet joints. You get inflammation in any of the joints, shoulders, neck, anywhere, and that can cause pain. But the good thing is that it can be treated. We have to go after the source. It's usually some sort of inflammatory process, like in the back, for example. You have pain in the back from inflammation, and once we make that diagnosis, there's a procedure that's called radio frequency. Actually burns these tiny little nerves that cause pain from those joints. We can do that in the back, in the hip joints, knee joints, just different places.
So for people who are living with chronic arthritis, this could be the relief that they're looking for.
Absolutely, and we help a lot of people with that.
Okay, so should anybody come that's got shoulder pain and then they think that it's going to take more than just, like they've gone for the massage and it's not working, so they come to you. So what do you do then?
The first thing that we're going to do, Cindy, is make a diagnosis. So we're going to take a good history examination, probably send this patient for an MRI, find out whether there's a tear, arthritis, something else going on, because you have to make a diagnosis first before you can actually go with the treatment. Right,
and your goal is to try to find a way to treat that without having to go to the surgery.
Surgery should be the last option on everybody. Sometimes you need it.
Right.
But, once you get it, it's a long recovery process, so we want to do everything possible to avoid that.
Good stuff. All right, Dr. Gari, thank you very much. You can visit their website, floridapainreliefgroup.com, to schedule your same-day appointment, or give them a call right now. 844-KICK-PAIN. Dr. Rudy Gari, great to see you.
My pleasure.
We'll be right back.